won't cover the first day, which is one of the most expensive days in the hospital, and won't cover the discharge day, which is a day that you get all the instructions and maybe have some other tests to be sure you're okay. They're not staying long anyway. People are leaving hospitals ill now. They used to be they were convalescent when they left, but that is not the case. They're making hospital stays very, very short. And there are times when people might be able to go into a hospital and leave in 48 hours. Well, if the first day you're there is not covered and the last day is not covered, then most of what you have spent in that hospital has not been covered by your
coverage
insurance.
is pretty thin at that point.
Yes. And so there are a lot of gimmicks, and that's what people are tired of dealing with, of all these gimmicks that they come up with that will save them money from having to spend it on the patients that have paid into that system a long time. So it's an unfair system. It is a broken system. I don't see how anyone could be satisfied with leaving this system as it is, with all of the preconditioned and every kind of excuse they can come up with. And if they're not attached to a job, it's very hard to afford it. It's extraordinarily expensive to get health care coverage if you're just paying for it out of your pocket as an employer or as a self-employed person. And it continues to go up. The people are afraid to get sick.
Well, they should be, because it is so expensive. But again, I mean, the good news here is that the legislation that the House is looking at would actually solve a lot of those problems. It would actually mean that your employer, except for real small employers, would contribute and be required to contribute a decent share of your coverage. And if you were self-employed or looking for work, you'd still be able to get for coverage, and the amount you'd pay would be based on what you could afford, which makes perfect sense. And that way everyone would get good coverage they can afford, get into the system early, keep healthier, and save money for us in the long run. You know, the old saying, an ounce of prevention is worth a pound of cure. It's not just true for individuals, it's true for the system as a whole.
Exactly. Because we have satellite health clinics that are teaching people how to take care of themselves, and they can go there and get health information. They won't end up in the emergency room at 2 o'clock in the morning. We don't yet have the electronic record keeping. They can't look up and see what they have, and it's sometimes hard for the patients to communicate. That's a very expensive visit. And even if they could pay for it, it would be too much for the patient.
Right. It's impossible for almost anyone to pay for that, though. It's very expensive, and it's also, you don't want to be there in the first place. You want to be taking care of yourself, have a regular doctor or other kind of practitioner who can see and take care of you. And that's the best thing for you and your family, and it also saves the whole system money. The system's crazy now. We don't provide coverage to people except when they're desperately ill. They're sicker. It costs us all more money. It's a lose-lose situation for people's health and for nation's pocketbook, as well as taxpayers and families. Let's get everybody in the system, give them good coverage, pay for it in a fair way, have everybody pay what they can, contribute what they can afford, pick up the rest as a community. And by doing that, we'll actually have a system that provides better health and lower costs for the whole country.
Now, you're looking at the nation as a whole, and I'm listening to my district. What stage do you think we might be in reaching this reform?
Well, we're on the home stretch. That's the good news. We're going to see both houses of Congress, I think, pass health care reform by the first week of November, which is just 3 weeks from now. And then it's going to go to a conference committee, as you know, and come back with a bill that we'll see passed. People ask me when. I look at the calendar and I see Christmas is December 25th, so the Saturday beforehand, because people always take as much time as they can. But, you know, that's amazing. As the President says, Presidents back to Teddy Roosevelt have been trying to do this. And I really believe that with President Obama and this Congress, for all the fighting and everything else, we're actually going to see historic legislation passed. It's not going to solve all our problems by any means, but we are going to see most people in this country get good coverage they can afford, and we're going to see that from a choice not only of private insurance but public health insurance, and we're going to see a whole sense of hope that you actually can make change in this country, which is what people voted for last November.
And it's not going to be just dumped out there in one fair, quick scoop. It's got to be organized, and it has to be kind of phased in.
Yeah, it'll take a few years. I mean, but we'll have to wait. I think one thing people will be a little, you know, sort of got this passed, now what happens? Because you have to put this new system in place. You have to give chance for the requirement for employers to kick in. You have to give a chance for this new health insurance marketplace to tick in, to set up the new public insurance option. So people have to be a little bit more patient. But after waiting 100 years, waiting another 2-3 years to actually have this started is going to be worth it, because people will be looking at a situation where being really sick and uninsured won't lead to medical bankruptcy, or even having insurance sometimes lead to medical bankruptcy, and where you won't have to worry about that if you lose your job, or if your child graduates from college or high school and is out in the workforce, they won't have coverage. A lot of those anxieties are going to go away for families. And in your district, where so many people are uninsured, may not get every one of them, but a lot more people are going to have good coverage.
A lot of the young people, recent college graduates, whatever, just say they don't have insurance, they can't afford it, and they're well right now, but nobody stays well forever. You know, I think the minute it passes, we're going to see a difference in how the insurance companies function. If they know something is coming that's going to bring some more satisfaction to patients, then hopefully they will improve what they're doing now. Even if it takes 3 or 4 years to phase in the new structure, and it will take a while. If it's going to be done correctly, it'll take a while to get it done. This is a huge, huge change, a change that we have worked for and talked about, like I said, almost 100 years,
Right.
but at least it's been over 40. It's been almost 50 years that we've tried to work on it, and each time these insurance companies will have saved up enough money to bat us down. But I think this time the public is putting enough pressure that we're going to get a change, and we need it so badly. And so can you keep that momentum going?
Well, we can. The way we're doing it is at the grassroots, because really, 1,700 insurance company lobbyists here. We got tens of thousands of activists back at home, people who are meeting with their members of Congress, going door to door in their communities, talking to people wherever they are, where they worship, where they work, and their families, and basically letting people know that this is how you can have an impact. You can make a call to your member of Congress, you can write a letter, you can write a letter to the newspaper, you can speak out, and basically give folks like yourself in Congress, you don't need the backbone, but unfortunately there are some members of Congress who could use a little propping up, and we want to be sure that all around the country. The other thing I want to say is that a lot of what we've based this on is we call congressional champions. Members of Congress who aren't going to say, I'm just going to compromise for the sake of compromise, who are fighting hard for a real strong plan. And at the end, the reason we're going to win this with a strong plan is because there are members of Congress who are champions and not ones who are sort of scared of their own shadow.
Well, thank you. Let me ask one final question. Do the people, the advocates out there, outnumber the people that disrupt the town hall meetings?
Absolutely. And we saw this in the end of August. The press wanted to show the disruptors. By the second half of August, there were many more people, usually 5, 10 to 1, people supporting reform at these town hall meetings. But it doesn't make such good TV to see people being there orderly asking questions. It's only when someone's disruptive that the TV wants to show it. But the American people are for reform. They've shown it. They're continuing to show it. And we're going to beat the insurance industry. We're going to beat those others naysayers, and we're going to make real change this time.
I'm very pleased to have this advocate group because it helps us with the courage, because we do have a number of people who are determined, and I have to put myself in that category. We've got to have some change. We must look out for our consumers.
We do. We do.
Thank you so much for taking time to come and visit with us on healthcare reform. Keep your job going. Keep that momentum going. I don't want to get there at the last minute and something happens. We've got to do it. See you next week.
This has been another edition of Report from Washington featuring Congresswoman Bernice Johnson. You can reach Congresswoman Johnson at 202-225-8885 or 214-922-8885. You can also contact her through her website at http://www.house.gov/ebjohnson.